Hello everyone, I'm Adam from New Forest Physiotherapy Clinic. I'm here with my assistant Rosie, who happens to be my daughter as well. Now I've had a question from a patient about breathing exercises. She was suffering from COVID-19. She ended up in hospital requiring oxygen. She was sent home after a couple of weeks, but she wasn't given any breathing exercises. I think that was in the early stages. Maybe the physios weren't yet covering the wards. But she wanted some breathing exercises to help her recover, and I think this would be useful for a lot of people who are recovering from COVID-19 or from pneumonia or a breathing problem that has blocked up their lungs. Now it's important to understand the anatomy of the lungs and how we breathe before we start these exercises. So what I want you to do, Rosie, is make a fist with your right hand and just place it up against your chest. Now that fist represents your heart, okay? And if you all do that as well as you watch this. Now, approximately where she's placed her fist there is where her heart is. Above it, on the left, we have the left upper lobe. On the opposite side, we would have the right upper lobe. Now, the left lung doesn't have a middle lobe because the heart sits where the middle lobe would be. On the right side, we do have a middle lobe. Okay, if you just turn sideways on, Rosie. Okay, just lift your arm forwards. Now I want you to imagine an imaginary line coming up here, and at the back here you have your lower lobe. The lower lobe of the lungs are the largest lobe, okay? So on both sides we have the lower lobe. Generally, when you get something like pneumonia, it's the lower lobes that we need to get reinflated. They're the ones that fill up with sputum and get blocked up, which ends up reducing your oxygen level. So that's why people end up having to have oxygen, is because their lungs are full of sputum. They can't use them for the alveoli, the little air sacs where the oxygen goes into the blood and the carbon dioxide comes out. It can't work because it's full of fluid, okay? So these lower lobes are the lobes we want to reinflate with breathing exercises. If you just turn back around, Rosie. So we have different mechanisms for breathing. The diaphragm is a muscle that kind of, if you just pop your arms down, is a muscle that kind of, it's like a dome here, kind of cuts us in half. Okay, it separates the chest cavity from the abdominal cavity. And that diaphragm, when we breathe in using the diaphragm, it kind of flattens down and it pushes the stomach out. Okay, so we know when we're using the diaphragm because the ribs don't move, but the stomach does move. Okay. The other mechanism for breathing is the ribs. So the ribs come round the body. If you just turn around, Rosie, like so, and we've got ribs going up and down the rib cage, 12 ribs, and as they lift up, it basically causes the lungs to expand, drawing air in, and as they drop down it causes the lungs to deflate. Okay, so what we're going to start with, Rosie, is diaphragmatic breathing. So if you just place your hand on your stomach here, okay, without moving the ribs and without moving the shoulders, I want you to take a deep breath in. So as you breathe in, your stomach pushes out, okay, and then out. So you're breathing here into your diaphragm. Deep breath in and out. Good. And again, deep breath in and out. Okay, that's good. So that's good diaphragmatic breathing. If you just turn sideways on, okay, just turn back that way so they can see you. Just put that hand down, put your right hand on your stomach, okay, and just try it again. So breathing in to the stomach. That's it. So as she breathes in, her stomach pushes out, her ribs don't move. Okay. Deep breath in through your nose, out through your mouth. Okay. Good. And face that way. So that's diaphragmatic expansion. That's a really useful breathing technique to really get the air into the bottom of your lungs. Okay. Now, the other way to breathe is using your rib cage. So I'm just going to put my hands, Rosie, on your ribs. Just keep facing the camera here. Okay. So as you breathe in, your ribs are going to expand, Rosie. Put your arms down so people can see. Okay, so you breathe in through through your nose, expanding the ribs, and out. That's it. And again, nice deep breath in and out. Okay, keep the shoulders relaxed. Okay, you want, when you breathe, if you don't want to hunch the shoulders, you want to keep the shoulders nice and relaxed, because what we don't want to do is just have the air coming just into the top of the lungs. We want it to really sink down deep into the lower lobes of the lungs. Okay, so just try that again. Deep breath in and out. Okay, good. And then do the diaphragm, so breathing here. So hopefully you can see the difference there. When she breathes with her diaphragm, the ribs don't move. When she's breathing with the ribs, her stomach doesn't move. Okay, so there's two different breathing techniques. Rosie's quite good at this. Usually people breathe with one method or the other, and so they'll find one method easy and the other one difficult. But the best breathing really is with the diaphragm. If you can master that, that would be good. Okay, so active cycle of breathing technique is you're going to do 4 deep breaths with a huff and a cough, another 4 deep breaths with a huff and a cough, and you could just continue that cycle until you've cleared phlegm off of your chest. Okay, so Rosie, what I want you to do, we'll start with rib breathing. I'm going to put my hands on your ribs, so I want you to do 4 deep breaths with your ribs, in through your nose, out through your mouth. Nice deep breath, nice deep breath. That's 2. Relax the shoulders, get the ribs moving. 3, one more. Nice deep breaths and out. Okay, with a huff. So it's a big breath in. Do that again. Okay, imagine you're steaming up a mirror, okay, and you're trying to get it nice and steamed up. Okay, and that can help to just bring phlegm from in the bottom of the lung here up into higher up into the lungs. What we want to do is clear the sputum from here and get it up into the larger airways. Okay, from the larger airways it's easier to cough it out of your mouth and out of your lungs. Okay, so that's what huff will do. Now I want you to put your hand on your stomach, and I want you to do 4 deep breaths into your stomach. 2, 3, nice deep breath. 4, and then do a big strong cough into your hand so you don't spread it everywhere. Okay, so that active cycle, you do 4 or 5 deep breaths into your ribs, huff, cough, 4 or 5 deep breaths into your stomach, huff, cough, and you could just keep repeating that cycle until you clear some sputum off your chest. So I'm going to demonstrate for you now a postural drainage technique to help drain phlegm and sputum out of the bottom lobe of the lungs. What you need is 4 or 5 pillows on the floor, like so, and then you get your patient to lie over the pillow. So if you could lie over there, Rosie. That's it. Okay. So they're lying over, and we call this a postural drainage position because the lower lobe of the lungs here at the back, as I explained earlier, with gravity now, if there's any sputum in here, that sputum is going to be working its way down with gravity towards the larger airways, where Rosie will be able to cough it out a lot more easily. Now we can encourage that sputum out of the lungs by doing something called percussion. Now to do that, you need to cup your hands like so, and you just on the back where the ribs are, you just tap the back. Now Rosie's wearing a thick jumper. If she wasn't wearing a thick jumper, you could take a towel and just put that over the person's back like so, and just cup your hands like so. Now Rosie, obviously she's only a child, so I can do this with one hand and I can cover a good portion of her lungs. If your patient's bigger, okay, an adult basically, you can do it with 2 hands, like so. And you'll know if you're over the lungs because it will make a nice resonant sound. Whereas lobes. If you're not over the lungs, it makes a different sort of sound. It's like a dull thud as opposed to sort of a hollow resonating sound. I don't know if you can hear the difference there. Can you hear the difference, Rosie?
Yeah, that if you do it there, it's kind of deeper.
Yeah, it's kind of a deeper thud there, whereas there's resonant sound here. So you could do this for 5-10 minutes. Probably you, the person doing the treatment, will be the one that gets tired out. And we're literally percussing the sputum out of her lungs. And as I said earlier, most of the sputum will be in these lower lobes. Don't forget, you need to do it on both sides of the lungs. And what you could do is get her every now and again to try a huff. Can you just try a huff in that position, Rosie? So it's mouth open as if you're steaming up a mirror. And you could percuss while she's doing that. Try a cough. See, she's sounding chesty because even that little bit I've done has helped to clear a bit of sputum. You could hear a little bit there. Okay. The other thing you can do is a bit of shaking. So just take a deep breath in into my hands and out. And as she breathes out, you just kind of shake the ribs. And again, deep breath in and out. Also in this position, you can make sure she's expanding the lower lobes into your hands. And again, deep breath in, nice deep breath, Rosie, and out. Nice deep breath into my hands, Rosie, and out. And percuss. Shouldn't be painful. And try a cough.
It does feel quite weird.
Okay, so those are breathing exercises and postural drainage techniques to help clear the lungs. Now, you've got to be careful with this percussion and shaking. If you've got osteoporosis, you could have brittle ribs. So if you're an older person with osteoporosis, you need to be very cautious with this. And if you've someone who maybe gets headaches or has increased intracranial pressure inside the skull, again, tipping the head down will increase that, so just be cautious of that. If you've got any other major sort of medical conditions, then you may need to check with your physiotherapist or your doctor whether or not you should be doing this. But assuming you've got no other medical conditions other than recent pneumonia or COVID-19, which has caused pneumonia in the lungs, then you should be fine with this kind of technique. Thank you. Hope you found that useful. Goodbye.